Hi everyone, John Kozeski here with the Broadview Heights Chamber of Commerce, your small business advocate. We miss seeing all of you on our Thursday networking lunches, but in an effort to get over that, we are focusing on some distant socializing here at the Chamber of Commerce. So to help me with that today, I've invited one of our longtime chamber members, Ed Aube of Rehab Professionals of Cleveland. Ed, how are you today?
Good, John. How are you?
Doing well, doing well. First and foremost, how are you and the family doing?
We're doing well. My son's missing his classmates at the University of Toledo, but he's getting along, finding some jobs, and we're able to get outside a little bit now, so that's not so bad.
Everybody's home and healthy, right?
Yep.
All right, that's what we like to hear. So, for those at home who aren't familiar with Rehab Professionals of Cleveland, why don't you tell us a little bit about what you do?
Well, we're physical therapists. We have three therapists: myself, Maria Nolan, and Matt Kubalski. Just joined us last year. We treat all sorts of musculoskeletal conditions such as sprains and strains, back and neck pain, sports injuries, work-related injuries. We can see you after your surgery, say if you had a total hip or a rotator cuff repair. We can help you take care of that. If you have tennis elbow or a lumbar radiculopathy where you got pain going down your leg, we can help you with that as well.
Well, there's a 100% chance that I'm going to have tennis elbow from opening and closing the fridge when this is all over. So I'll be coming to see you.
Okay, we'll fix you up.
So speaking of all that's going on in the world right now, obviously this has to be affecting your business quite substantially. So why don't you tell us a little bit about how you're adapting to these new times?
Yeah, well, people are trying to be compliant with the stay-at-home orders, but they still have trouble. So fortunately, physical therapists have gotten Medicare and a lot of the big health insurance companies to cover what we call telehealth visits. So we can perform an evaluation and perform some sort of treatment over the internet. So fortunately, we don't just have telephones now. We can watch people move, and watching them and also asking them some pointed questions. We can make a diagnosis and also instruct them in, say, an exercise program or some behavioral modifications, changes possibly to their workstation if they're having some neck or back pain from, trying to do their work from home on the couch, things like that. So, we can continue with people's programs and even we can get them started now. But our staff has also modified how we do things so that if people do want to come into the clinic, they can feel safe. All of our providers will be wearing masks now. Things are clean, as people come in, as they leave. We're, spreading out our schedules so we only have a couple of people in the clinic at a time. And, we're taking everybody's temperature as they walk in the door, and they wash their hands when they come in, wash their hands when they leave. So far, things have gone well. But people still have the option of coming into the clinic or staying at home, and we can communicate with them just like we're doing right here.
That's amazing. That's amazing. Well, I can say firsthand, having once been a patient of yours, that your clinics were always spotless. So when you say you're taking extra precautions, I can only imagine what that means.
You don't want to be a fly in here.
Well, we have your website right here on the screen, so anybody at home that is in need of your services or maybe in need of your services from home, they can certainly reach out. But for those who are staying at home, do you have any advice on how to stay healthy during these unusual times?
Well, get up and move around. It's pretty easy just to sit in front of the TV, but even if you're going to do that, get up, stretch a little bit, stretch. If you've been sitting for a long time, bend backwards a few times. That'll take some tension off of your posterior structures of your back. Turn your head, turn it the other. If you're at your laptop, make sure it's close enough to you so you're not leaning forward. The other thing that people forget about is their eyesight. Make sure you have an eye exam, on a regular basis so that you don't have to lean forward and strain your eyes and give yourself neck pain while you're trying to do your work. The other thing also is that we can see people basically right off the street. We have direct access here, so you don't need to go see your doctor. You don't need to, tell your insurance company you want to come and see us. You can just call us up, make an appointment, either come in or we can do it, over the internet. Yeah. So that by coming to us directly, you can save yourself primary care visit, an MRI, blood test, medication, specialist visit. and get started right away. When we see that there's an issue that needs to be addressed medically, we make sure we refer you right away to appropriate medical personnel.
That's fantastic. That's fantastic. Well, it sounds like you've been keeping pretty busy, regardless of what's going on. But certainly, we all at least have a little bit of extra time on our hands these days. So, have you read the Webster's Dictionary cover to cover yet, or what are you doing to keep busy?
I did it backward and forward. So fortunately, we can get outside now. So I play in a baseball league. So I've been out. I got a rubber ball. I go up to the school and throw it against the brick wall. Hopefully, the school won't fall apart. My son, he dragged me out to hit fly balls with me the other day. He was like, "Dad, this role reversal is great. When you were coaching baseball, you'd be dragging me out of the house. Now I'm running drag you." So that's what he did.
I love it. I love it. Well, last question that I didn't warn you about, but I know that you are as much of a fan of the boss Bruce Springsteen as I am. So if we needed one Bruce Springsteen song to add to our playlist during quarantine, what would it be?
Glory Days, but I think the police have a better song.
Which one's that?
Don't Stand So Close to Me.
Well, I was hoping you'd say Glory Days. That was the right answer. So
Okay.
we'll all be thinking about those.
Yeah, you see the poster there?
There it is. I knew that was there.
That's right.
Well, Ed Aube of Rehab Professionals of Cleveland, thank you for joining us today. We certainly appreciate it. Like I said, their information's here on the screen if you're in need of their services or have any questions about anything you heard today. My apologies to George Clooney. We couldn't get to his interview, but we will certainly get to him in the next one. In the meantime, keep home, keep healthy, keep shopping local.
Hey, John.
Yeah.
I'm not open for George Clooney again.
I'm going to include that. That was good.